Okay. Okay. Yeah. Well, actually, I'm better standing, I think. Well, geez, I'm speaking here as the forum co-chair along with Suzette, and you've achieved much of what we had hoped for when the forum asked for this workshop to be established. Get closer to the mic, says Lisa. I'm a soft talker like a number of you, to follow Jerry Seinfeld. But especially of interest to us here is how do we move this, as Joe said, how do we move this the next step? Because collectively, I think you understand the taxonomy or who the players are. You understand something about the functionality of each one of those players. You understand some of the Boolean algebra where the overlap between diagnostic services supporting clinical care and surveillance, and I know that's a bad word now, but you understand all that. So none of this is new. But it's sort of stepping back and then putting this down into, here are the roles and responsibilities that X owns, Y owns, Z owns. And then here's how those functionalities that they have the responsibilities and the roles engaged to can be utilized against various threats, which goes to Gigi's point about exercising. Developing the playbook against various threats, exercising that playbook, finding where the gaps are still, and filling those gaps. I'm sorry, I'm an old operator. That's the way you do things, right? You got your initial action plan, and this group knows what that is, but you need to put that down on paper and say, this is what we're committed to, and here's how we're going to move forward. Then you have your situational report. Here's where we are now. We've made this movement. And then you do an after-action analysis once you've exercised, and this goes to your military notion, Matt. You look at that after-action, and there are lessons observed, but are you going to actually implement them in a way that become lessons learned and executed? I think, there are a number of answers to a number of the questions that were raised here. And Chris's shop, for instance, you've got the industrial base management crowd now. You can go to that IBM crowd. They work the DPA, they work the OTAs, the other transactional authorities. You can bring the manufacturers to them and say, these are the critical manufacturers for our segment of the national response activity. How can we establish a warm base relationship, or we can establish a contractual relationship to be invoked when we enter an emergency, and they're going to be paid at this rate so they can plan forward? I mean, I'm getting into the weeds here, but there are solutions for much of this, okay? The authorities that were provided under the PREVENT Act widened out ownership of those authorities across HHS. Now, I'm not sure that FDA and CDC have the experience with DPA and with OTA, but certainly there's vested interest and vested experience within ASPR. So there are solutions, but you have to engage it and say, this is what we're committing to. Frameworks, and Chris, I agree with you, the best work that we do here is framework. So we did the supply chain analysis under the CARES Act. We said, here's the framework. We got to mitigate this problem, reduce our risk, then we can act to do certain things in preparedness or readiness, and then we can do certain things in response. And that's exactly what you could look at here. How do we mitigate the risk of running out of swabs, running out of reagents, running out of whatever? That's a mitigation question. Then you can do your preparedness component by doing the exercising built on the playbook that you work. And then when you have to respond, you can invoke the SNS piece of this, right? Because you can do that kind of buffering in the process. So what you've discussed here reveals that you all pretty much see what the issues are. You all pretty much see how some of that solution looks. It's like, okay, what do we need to do to sign on the dotted line that says, here's how we're going to go forward? It's leadership. Collectively, we have leadership in this room. You need to come together and say, here's the product we're going to deliver and work to. Susan and her folks have given some thought to this and have some stuff already codified. They're already working the Hill. Papa's, Joe brought up some things around One Health. Papa's being reauthorized. You got 6 months, people, if you're going to impact that particular set of legislation. So from the forum perspective, what we want is what you've done. You've identified, here are the issues. Here's sort of a general framework of things that could be done together. Now, you're the owners. I'd like to see you drive the car, because the National Academy could only go so far. Then it has to be the stakeholders that take it and run with it. So I know that's not terribly helpful from my point of view. We're not going to own it. We do, because we would fully want to support you in that process. But you're the stakeholders. You're the owners. How can you put it together and lead your organizations into a national solution, not a federal solution, a national solution? Okay, Suzette, your turn.
Well, Craig, you hit all the points that I was going to hit. So I actually have some forum acknowledgments to make, so I wonder if we should go to Asha first before I do those. So I'll be quick so you can get to your forum acknowledgments. But first, I'd like to acknowledge our co-chairs. Thank you for allowing us to hold this workshop. I want to thank our facilitators today, Susan Van Meter, Brandon Traxler, and Joanne Andreadis. Did I get it close? Yeah? Okay, good. There are, I don't want to take the time today that we took yesterday for me to go through interesting points, but I do want to reiterate a couple of things before we leave. One is that I remain convinced that we need to reframe some of the things that have been holding us back for so long. We talk about workforce, and then we go out and we list some of the most boring job descriptions ever seen on the planet in USA Jobs and our local newspapers, and we wonder why nobody wants to come in and become a public health surveillance and detection something or other. Nobody knows what that is. Yeah, no, we need to do that. Look, we already have a term. We were talking about it yesterday. You list for disease detectives, and I bet you're going to get more people to come in. I think we have to change how we talk about ourselves and our situation. And, we don't need funding from Congress to do that. I think we can do that now. When we talk about the pandemic, the best explanation I've ever given to somebody in the public, the kind of pandemic that we're worried about beyond COVID, is not some esoteric, super detailed, scenario-driven tome. It is World War Z. And they get it like that. They're also looking for Brad Pitt, by the way, so I want us to find our Brad Pitt. So as we're talking about strategies, and we're thinking about the future, we touched on this a little bit towards the end. We don't just need a laboratory and science-driven systems perspective that's only internal. We need those enablers. We need people who know how to talk to the media. We need people who know how to engage with the public. We need people who understand that there's a word called risk and a word called communication. And those two things come together to form a different phrase, and they have to understand what that is. And I'll tell you, we talk a lot. It's easy, especially here in Washington and here at the Academies, to talk about the role of Congress. And throughout these 2 days, we've heard a lot of words like make. We need to make the states and locals and tribes and territories share data with the feds, or we need to make the feds do X and Y. Not all of that has to happen. Maybe some of it shouldn't even happen through congressional mandate. We do have, and I'm going to say it again, I said it yesterday, we have a notion, this thing called federalism in the country. And we also have something called the private sector. It is amazing what can happen when you can get different people to get motivated to do something. I am telling you, you are not going to need a congressional mandate. We're not going to need a congressional mandate for some of the things we're talking about today if we were able to get the governors to all jump on board and say they were going to do something. We wouldn't need it. But in order to engage them, we would have to invite the National Governors Association to our meetings. And somebody would have to be at the table from the U.S. Conference of Mayors, and so forth. Not to rag on ourselves, I was on the planning committee too, so, but we need to think about that as we think about our next step. So the question is, I've heard this a few times now, we're all asking, what are the National Academies going to do next? We're going to produce proceedings in brief, right? So thank you to everybody for getting your thoughts out there and on the record. Appreciate it. It's going to get into the proceedings. Hopefully, we're going to have another meeting after this. And then the National Academies, I mean, clearly they made a commitment to this. I think it's important to have the Academy's name on something, that the Academies are saying that this is important. But that's not enough. I know we're asking, what is the United States government going to do? The government's doing some things. I think we're a little worried about what happens when there's a transition in the administration, what happens when people retire from the federal government. I don't think we should be weeping because poor Tony Fauci is tired and decided he wanted to retire. I think the question is, I mean, weep if we want, but we need to find out who the next person is that's coming in behind and where are the other spokespeople. We also want to ask the all-important question, what are you going to do? Craig just brought this up. I'll say that there's a variety of things that we can do. I myself think I should probably write an op-ed, and maybe that op-ed doesn't come from me. Maybe it comes from Joe Lieberman and Tom Ridge as the co-chairs of the commission. But I'd like us to think outside the box about this because I think it's incumbent, it's our responsibility to keep the ball rolling here. If our big plan is that we're waiting for the National Academies to get funding from somebody to keep going, that's not enough of a plan. If we're committed, let's be committed and let's try and do some things ourselves. Lastly, I have to say, some of us have been in this room or rooms like this since at least 1998 that I'm aware of. It's 25 years of National Academies meetings where we're talking about lab systems and, geez, what's going to happen when we have the next pandemic or the next outbreak or the next whatever. I'd like us to, I mean, of course, let's keep meeting, that's great, but let's see what we can do about identifying the next big step we can take, not just the little steps, but the next big steps. I want to thank the National Academy staff. I want to thank our co-chairs, and I want to thank the people who are members of this forum and who support the forum. I think the activities here are really important, but they're just a catalyst, and we're all going to need to take this football and run with it, not just as the quarterback, I guess, but also as the offensive and defensive lines. So thank you very much. Thank you for bearing with me and my commentary, and I will hand it over to Suzette. Oh.
Asha, you know, I have to say when we were meeting to Craig and I and the NASM staff, we were trying to figure out who could we possibly get to chair this committee. And your name was one of many names that came up, but I just want to say personally, both as my colleague and my friend, thank you so much for the hard work that you've done working alongside the planning committee. Andy made a comment to me at lunchtime, but I have to say I wholeheartedly agree with him that this is one of the best workshops that I've certainly seen this forum put on in many, many years. I was actually just thinking back, when was my first interaction with the forum? It was in 2008. So, and that was, Lisa, you may remember, that's when we were first gearing up doing the crisis standards of care work. And I think that first report had either just come out or it was on its way out. But to Asha as well as the entire planning committee, job well done, and thank you all so very much. Interestingly, as we get to some acknowledgments, this seems a little bittersweet. I actually kind of feel about this announcement the same way I felt when my daughter was going away to college, but a little weird. But at any rate, what I will say as we begin to round out and close out our day today is, you know, this forum brings together some of the nation's foremost leaders across the government, non-for-profit, as well as the for-profit sectors at the state, local, tribal, and territorial levels to solve, or at least to discuss and work on some of our nation's most pressing issues around medical and public health, emergency preparedness and response. We have 4 members of the forum who are going to be rolling off this spring. And so I just wanted to take a few moments to acknowledge those 4 members. And they are John Osborne from the Mayo Clinic, Lou Radonovich from NIOSH, my former co-chair, Dan Hanfling from NQTEL, as well as Tara O'Toole from NQTEL. And none of them were able to be with us yesterday or today for this workshop, but I just wanted to take a moment to acknowledge the 4 of them and thank them for their many, many years of service on this forum. So maybe if we could just give them a round of applause in their absence. And with that, Lisa, do we have a word about when the planning committee or others that are interested may expect to see the workshop proceedings?
Yes, so I think the proceedings will probably be released in May or early June. It's kind of, so early summer is the timeline that we're looking at.
Great. Thank you so much. Ladies and gentlemen, thank you all for your time and your attention over these last 2 days. We are adjourned. Thank you.